Welcome to Olive Nurses Academy. Let's start our today's section. It is the revision class. So today we will begin with the first part will be the question answers. Okay, so question answer key points only. I will be giving the key points of question answer, previous question answers, and second part we will be discussing the endocrine questions. Okay, so endocrine and as well as the eye and the urinary system also we will look for that. Okay, so we'll see about 50 question key points. Okay, so first part will be key points. So just remember the site of lumbar puncture, it is L3, L4. Okay, so nephrotic syndrome treatment, one of the question that is not the direct question. I have told you already, they will give you the situation and the end point. I have taken you because so many questions, we cannot display every question. Okay, so you have to take the key points and we have given you as like this. Okay, so remember, I will just dictating the key points, try to be remember. Okay, so next is nephrotic syndrome treatment. What is that? Corticosteroid. Because the nephrotic syndrome, most of the time it will be the autoimmune. So the corticosteroid will be effective. So Down syndrome features. What and all the Down syndrome baby features? It is flat facial features will be there. You see the nose are flat, ears are short. Okay, small head will be there and eyes will be slanted upward and the poor muscle tone. The important one is single palmar crease. They have only single palmar crease. Okay, got the point? So we'll move on. Next, apical pulse site. What is the site? It is fifth intercostal space and affects of the heart. Sometimes it will be the mid-clavicular line. Okay, so option will be differ. You have to know the site carefully. Okay, apical pulse will be palpated in the fifth intercostal space. It is in the left side. Okay, affects of the heart. Sometimes we will just give you the mid-clavicular line. Okay, so remember that. Okay, the shortage in the staffing. Okay, this is about the administration question. Remember, shortage in the staffing and problem happen. Charge nurse should inform to whom? That is the question. So nursing supervisor, you have to know the hierarchy. Whom should be communicate with whom? That is the organization chart. Okay, so charge nurse should be informed to the nursing supervisor. Got the point? So they will be giving the many points like a option like doctor and the specific unit leader like that it will be there. So you have to choose charge nurse already charging into the unit. So next it will be the nursing supervisor. Okay, got the point? So next one, see, nursing supervisor give task to the nurse according their skills. What is mean by that? Okay, we have seen already administration card. That is the delegation. Okay, according to the nurse. Okay, so new nurse is coming. So any nurse capability, there will be giving the assignment. That is called the delegation. Okay, got the point? So delegation is the answer. Heat loss mechanism in newborn. Which one? We already seen in the classes. Okay, so newborn class, you will be studying this heat loss mechanism. So I will be posting that in the next few days. So radiation, conduction, convection, evaporation. Okay, it will be the different type of question. So I will be just teaching in the newborn care. Okay, don't worry. We'll move on to the next question. Okay, diet for the nephrotic syndrome. Okay, so nephrotic, again, sorry, nephritis syndrome. So what will be the diet? Low sodium, low fat. You have to remember nephritis. So there will be the, what is the problem? Kidney problem. So you have to give all the low. Okay, protein should be low, salt should be low, sodium, fat, cholesterol, everything should be low. Got the point? So next is intussusception. Okay, so what is the late stage in the intussusception? It is red jelly stool or currant jelly stool. Okay, sometimes currant, they will mention you that point, currant jelly or red jelly. So both is same. So red jelly stool, it is the intussusception later sign. Okay, next one is clomid medication side effect. What is the clomid medication? That will be the contraceptive medications. Okay, so this medication side effect mainly abnormal vaginal and the uterine bleeding, flushing and diarrhea. Okay, so these are the symptoms. Just remember these are all from the rare questions. So I will be mentioning you clomid medication side effect, vaginal uterine bleeding, and there will be the flushing or the diarrhea will come. Okay, got the point? So we'll move on. Next question, 11th question C. So these are the key points. So don't expect the question like small. Okay, it won't become small. It will be very big only. You have to be, I am giving only the key points. Okay, got the point? So cervical dilatation and fetal heartbeat. Okay, fetal heartbeats monitoring should be every 30 minutes in the active, okay, active labor piece. During the active first stage of labor, remember, and every 50 minutes during the second stage. Okay, so during the first stage of the labor, there should be the every 30 minutes you have to look for the cervical dilatation and fetal heart rate. Got the point? But if it is second stage, every 15 minutes, okay, so because the baby is already going to deliver, the full dilatation is happen. Okay, OBG class you will be studying. So remember 30 minutes in the first stage labor, active phase. 15 minutes, every 15 minutes assessment for the second stage labor. Okay, fertility test. Okay, if they ask you fertility test, it is semen analysis. Okay, got the point? So next one, complication of postpartum hemorrhage. It is death. Okay, death is the postpartum hemorrhage complication. It is the very major cause. Okay, so it will lead to hypoglycemia, the hypovolemic shock. Then it will go into the death. We'll move on. So these are your previous question paper. Concentrate. MRSA. What is MRSA? Methicillin resistant Staphylococcus aureus. Okay. So that will be the contact precaution should be that. Okay. Mainly for the smallpox is airborne isolation precaution. So MRSA question come, you have to remember contact precaution. Okay. Second one, smallpox, it is the route is airborne transmission and there should be isolation needed. Got the point? So next one is nurse role after the epidural anesthesia. What is the nursing role? There is the epidural anesthesia patient easily can get the respiratory distress. Okay, so epidural anesthesia patient, what will be happen? All opioid, narcotic, the narcotic analgesic will cause what? Respiration depression. So you have to check the respiratory status. That is the important one for the nursing role for the epidural anesthesia. Got the point? Next one, Ebola virus. What is the transmission? It is contact. Okay, Ebola virus mode of transmission. It is contact. Got the point? Okay, so MRSA also it is contact precaution needed. Mainly MRSA because of the healthcare workers, poor hand hygiene. Okay, so that will be cause the no aseptic techniques that will cause the MRSA infection to the patient. Okay. So meningitis vaccine. What is the vaccine for the meningitis? It is meningococcal vaccine. Got the point? So next one, COPD. That is a chronic obstructive pulmonary disease. The nurse should caution with what? Oxygen. Because we have to be give small amount of oxygen because it will cause the hypoxemic thrive will be done. So that's why we are just giving low oxygen because the patient is already CO2 increase. Okay, that is hypercapnia will be there. That's why we are just giving small amount of oxygen. Okay, COPD patient. Got the point? So next one, epidermic disease. Okay, so I have told you already during community epidemic. What is the example? It is TB. Okay, so what is the precaution we will give for the TB? It is the isolation airborne precaution. N95 mask we will provide for the patient as well as the visitors. Whoever in the going to enter into the patient room, they should be in the N95 mask. Okay, so epidermic disease. Don't forget. We'll move on. Only 50 key points. Then I will be displaying the endocrine and the eye and the urinary system disorder. Whatever we studied in this week, we will be seeing the question answer. Okay. So next one is hepatitis A. What is the mode of transmission? It is contaminated food. Don't forget hepatitis A, contaminated food. Hepatitis B and C, it is blood and blood product. Okay. And sexual transmission also. What about the hepatitis E? It is a contaminated water. Don't forget. Okay. And there will be the hepatitis D. It is a complication of hepatitis B. Okay, so we have already seen in the gastrointestinal system. Next one, Pregnant woman, 34 weeks with hypertension. What is called? During the pregnancy, it is pregnancy-induced hypertension. That is called PIH. Because it is the 34 weeks, they are developing the hypertension. Okay, between the patient will be developed the 20 weeks before there is hypertension, that is called not pregnancy induced. If it is after 20 weeks of pregnancy, newly the mother is getting diagnosed with the hypertension, that is called pregnancy induced hypertension. So here the 34 weeks, okay. So these will be seen in the OBG condition. Next one, rice diarrhea is called, what is that? Cholera. Cholera patient only will be having the rice diarrhea, okay. So here the next one, democratic leadership not suitable for emergency. Why? Because democratic leadership means we have already seen in the administration. What is mean by democratic? It is mainly, you have to remember, democratic, it is about the democratic leadership. What you have to remember, there will be the decision by taken by whole, okay. So it is one ward means the nurse manager and will be the nursing staffs, everybody together, they will be just taking the decision, okay. So that is called democratic leadership. So this democratic leadership will not be suitable for emergency, because if you just having discussed with anything and giving adrenaline, what will be there? There will be the time will be lack the patient, we will lack the patient. That is the matter. So only autocratic will be autocratic leadership for the emergency situation, crisis situation, okay. So disaster situation, you have to remember disaster, crisis, emergency situation. What is the leadership? It is autocratic. Only one person take the leadership and lead everybody. But the democratic, it will be not suitable for the emergency situation. It is for the hospital setup without the emergency situation, okay. 18-month vaccine is, what is the vaccine for the 18-month? It is measles, okay. It is 18-month vaccine called, it is the measles. Warfarin antidote. What is the warfarin antidote? It is the vitamin K. Remember, vitamin K, it is a warfarin antidote. Sudden outbreak of the infectious disease and unpredictable and large number is called. Okay, they will be asking like this also. So it is like a definition. What is a sudden outbreak? If they sudden outbreak, you have to remember epidemic. Okay, it is example TB. Suddenly there is outbreak of diseases. So epidemic, it will be the answer. Got the point? We'll move on to the next one. Okay. So respiratory syncytial virus. What is the mode of transmission? Contact. Okay. Respiratory syncytial virus, mode of transmission, it is contact. So dilatation of the cervix, 6 centimeter. Effacement is 100%. What is the stage of labor? That is the question. Okay. So remember, the patient will be in the stage, will be the first stage only. But in that, we have the stages. Okay. In the first stage labor, we have 3 phases. Okay. There will be the, if it is 100% effacement, that should be the active labor phase. Okay. So I will be teaching that one. It will be in the OBG. Okay. So just remember, it is 100%, the effacement is there. It is the active stage of labor. Okay. So next one, it is the, because if they have you just asking you the stage of labor, you should not answer like second stage, third stage, because cervix is 6 centimeter only dilated. Cervix 10 centimeter dilated only, it is going to the second stage of labor. Okay, don't confuse. So it is the active stage of labor. So next one, elderly woman came to the emergency room for the past year. This 4 times with the bruises and the injury. You suspected what? It will be the abuse. Okay. So what is the appropriate nursing action they are asking? So ER, they are just coming with the bruises. So it will be the 4th time. So we are suspecting abuse. So what is the nursing action? You have to remember, it is the legal case. So you have to notify the authorized, okay, authority person of the suspected elderly abuse. So that will be the police. So we have to inform to the doctor. So they will be informing to the legal case. Okay, so suspected elderly abuse, we have to report. Okay, so like that question in the fundamental and the professional nursing. Okay, so next one, Newborn immediately after birth. Okay, Apgar score, it is 7 and 10 in 1 and 5 minutes. Okay, what is the baby? It is called healthy baby because 1 minute there is 7 Apgar score. Then the 5 minute is 10. What is the score of the Apgar? It is 10 only total. So baby is healthy. Okay, so sometimes they will be asking the plainly normal question like that. Okay, you have to answer. So TB patient, don't forget N95 mask. Okay, so breastfeeding woman, her breast swollen and red. What is the nursing intervention? Okay, so remember, any abscess is not formed. Only there is swollen and tenderness, redness. They can be what? Feed the baby or not feed the baby. Nursing intervention, do not stop breastfeeding from the affected side and drink lot of water, Brufen analysis. Okay, because the patient will be only tenderness. We will be usually in the early stage, we will tell the mother to feed the baby. But if it is swollen, red, or any drainage, okay, so it is called abscess formation. So we should not tell the patient will be, if it is the any discharge, should not be feed the patient. Okay, but if it is only swelling and the redness is there, if it is not the discharge come out, any fever, they didn't mention the fever. If they mention the fever, that is the abscess. So you should not feed. But here you have to remember, do not stop the feeding. Okay, they can be feed because only the tenderness because of excessive milk secretion. So feeding from the affected side and drinking lot of water and Brufen, it will be helpful to reduce the tenderness. But if it is mentioned they have fever, there is breast discharge, you should not feed the baby for that breast. Okay, so that will be very important point. So from the question, take your answer. Okay, next one. Patient with the ileostomy. What is the possible development? Will be the metabolic acidosis. Okay, mostly the patient ileostomy, there is so much of waste will be stagnated inside the body, so it will cause the metabolic acidosis. Okay, ileostomy. So what is the complication of ileostomy? That will be one more question. So that is the fluid and electrolyte imbalance. Got the point? Complication of ileostomy, it is fluid and electrolyte imbalance. Okay, so next we will move on. Okay, don't worry. Only I think 50 or 58 key points we will see. Then we will move on to the question answer section. All of them should be answered. Okay. Patient develop metabolic acidosis. The nurse will anticipate he will be having respiratory rate is 30 and fast. Okay. So remember, it will be the question for the metabolic acidosis. What are the symptoms? Okay. So I have taken you that like that the notes. So it will be, you have to remember metabolic acidosis. Acidosis, it is all wastes are stagnating, not going outside. So the respiration and the heartbeat always it is high for the metabolic acidosis. Just remember that part. Okay. So remember metabolic acidosis, heart rate and the respiration will be high. Okay. So spina bifida position. What is the position? Prone position because the back part. Okay. The spine having the pouch like protrusion will be there. So spina bifida patient, you have to put the patient prone position. Okay. So next one, cleft lip surgery repeat between, when is the cleft lip? We will do the surgery 2 to 6 months. Cleft palate, it will be 6 to 1 year. Okay, got the point? Okay, 6 months to 1 year for the surgery. So if the patient is presented with cleft lip, cleft palate, both surgery when we have to do, it is at the 6 month. Don't forget. If it is cleft lip go alone, we can do the surgery between 2 to 6 months. Got the point? If it is cleft palate, we can do the surgery 6 to 12 months. So now the baby present with both cleft lip, cleft palate. So in between, so 6 months we will do both the surgery. Got the point? Okay, next one. Describe the nipples on the bottles used to feed the baby. Okay, with the cleft lip. So what is the description? Cleft lip baby, we have to have the large hold on soft nipple. Okay, that will be the bottle feeding we will give for the baby with the cleft lip. Okay, because they cannot just attach to the breast and they cannot suck out. So what we will do, we'll just give the bottle feeding. So that nipple should be the large fold and soft nipple. Got the point? Large fold, soft nipple. Got the point? So we'll move on to the next one. Cleft palate. What is the position after the surgery? Cleft palate after the surgery, prone position. Okay, so spina bifida position also prone. Cleft palate after the surgery, prone position. Got the point? Okay, but the cleft lip after the surgery, you never put the prone position because it will injure to the lip. Okay, so you have to be remember that points. Next one. Okay, cleft palate position during the feeding. During feeding, it is upright position. Okay, because there is so much chance of aspiration. So cleft palate during the feeding, it is upright position. Got the point? So before the operator to repair a cleft palate, okay, so before the operation to the repair the cleft palate, your baby need to be completely weaned from the bottle, drinking and effectively drinking from the cup. Remember? Okay, so that's why cleft palate surgery, it is from the 6 month to 12 month. Okay, because the weaning period, it will be mostly breastfeeding. It is the one we are at birth to 6 months. It is compulsory. After that, we can tell the baby to teach the baby to the weaning. Okay, so that will be the drinking in the cup and all. So after that, only surgery should be done. Got the point? Hope you understand. If you have any question, you can unmute and ask. Okay. A newborn infant of diabetic mother may develop what? Diabetic mother with the baby. Okay, newborn baby. It is hypoglycemia can come and baby is very big. Macrosomia will come. There's a chance of birth injury. Why? Baby is very big. So during coming out, during the delivery time, there is a shoulder dystocia. So difficult to do deliver. So there will be the forceps delivery can happen. So birth injury, it is a chance. So 3 will be come under newborn infant with a diabetic mother. Hypoglycemia, macrosomia, that is a big baby, birth injury. Okay, got the point? Next one. The infant with the cleft lip, cleft palate need more frequent burping after every 15 to 30 minutes because the cleft lip, cleft palate both will cause the aspiration. So after the feeding, we have to be every 15 to 30 minutes, we have to burp the baby until the burp come. Okay. Okay, here, cleft lip can breastfeed. Cleft palate cannot breastfeed. Why? Because cleft lip baby, we can just adjust and give the breastfeeding. Okay, but the cleft palate, if you give the breastfeed, it will go into the, because palate is not formed. So it will go into the nasal and through that, it will go into reach the lungs. Aspiration will come. Okay, you cannot breastfeed. After the cleft lip repair, what device will view the baby via? Okay, so that is the Logan bow. What is that? To protect the lip. After the repair is done, what will be done? The baby used to go and touch that lips or injury part, okay, like that. So we will be having Logan bow like that. We will fix it in the lips so that it will be covered until the suture removal. Got the point? Okay, what position is, it is all about the cleft lip in the all the question paper. Okay, so concentrate. What position is contraindicated after the cleft lip repair? Okay, never let them in the abdominal. That is means prone position. If you put the prone position, lip will be injured. Okay, got the point? So next one, immediately post-op position of the cleft lip and the cleft palate on side to stop drainage of mucus. Okay, so you have to remember side lying position. That's why immediately after cleft lip, cleft palate. So cleft lip, after that you cannot put the prone position. But the cleft palate patient, after the surgery, you have to put the prone position only. Now the both the surgery done. What you will do? You will just put the patient in the side lying position so that there is any drainage mucus, it will come out. Okay. Spina bifida. It is usually occur between where? It is L5 to S1. Okay. Spina bifida usually occur in the L5 to S1. Okay. Got the point? So we'll move on. Next one is appropriate child position after the tonsillectomy. Okay, if you remove that any surgery is related to the this respiratory, okay, respiration and the digestion, you have to remember tonsillectomy, or the patient will be having some esophageal surgery. Okay, so some nasal surgery, all that you have to remember. You have to put the patient in the side lying position because there is more chance to get the aspiration for the patient. Okay, so aspiration will come. So you have to put the patient side lying position to prevent the aspiration of some bleeding will be internal. So that will go into the lung. So to prevent that, we will put the patient in the side lying position. Okay. So we'll move on. So we are going to finish with this. Okay. we'll finish this and we'll move on to the next part. Okay. During a year examination, okay, ear examination, ear drops in children, ear will be where? Remember, children for down and backward. Adult for up and backward. Okay, already we have seen. So remember, children always down and backward. Adult is ear should be the up and backward. Okay. Woman complains of brown vaginal discharge in after 10 days childbirth. The woman needs more education about what? That is 10th day after the delivery. Okay, vaginal discharge will be the after the childbirth. It is the brown color. It is normal or abnormal? It is actually normal. So women need the what? Normal postpartum vaginal discharge. You have to give the health education. Okay, because it is normal. Got the point? Some questions are very, you can be able to identify how to be answered. Okay. A 50 years old man, okay, read the question, try to answer. Okay, 50 years old man present to the emergency department after having suffered a fall while practicing the mountain biking. He appeared confused and disoriented. His friends report that he had been thrown over the handles bar and hit his head against the rock. Okay, so this is the history. Just remember, head injury happened. Okay, so BP is 108/86, heart rate 102, respiration 22. There is a temperature will be 37.2. Okay, and the oxygen will be 99%, which is the initial intervention is the most important. Okay, try to answer. Okay, one person answer. Everyone try to answer. Okay, cervical immobilization. Very good. That is the answer. Okay, can you able to hear me? If you're not able to hear me, you can message in the chat box. Okay, so that I can know. Okay, thank you. Okay, what is the answer is D. Very good. You have answer. So cervical immobilization because it is the head injury. Okay, the questions will be very big only. Now we have to remember if the patient is having, they are specifically mentioned most important thing, and they have, there is the vital signs are normal. Okay, so we should not be need to select oxygen or the intravenous fluids. There will be the first priority cervical immobilization. Okay. So we'll move on. One more question. Try to answer. A surgical nurse is assigned to the care for the woman who had undergone vaginal hysterectomy. The nurse performed assessment. Which of the following potential problems that is nurse should observe? Vaginal hysterectomy. Just remember, vaginal hysterectomy, they are going to take the what? Uterus, totally. Near the uterus, what is there? Very good. Bladder dysfunction, okay? Because these are the organs work together. So then when they are removing the part of the vagina, okay, whole vagina, there is a chance to the bladder dysfunction. Okay, D is the answer. Very good. All of them should answer. Okay. Okay, these two I have given you the question answers. Okay, just read the question. The nurse was doing research with the two group of smokers. The first group took nicotine patch and the second group not achieved the target goal. What is the research type? Okay, so usually cohort study only we will choose two group and the one group will be mostly they will be affected. The second group is not affected. So that is called cohort study. So case study, it will be the, we will take the one group of people and do the case study. But the cohort study, it is the correlation study. Like that, we will compare. Okay. So this answer cohort study. Here the question, the psychiatric patient, she was speaking and laughing in the loud voice. She was wearing the bright color dress. Okay, what does it indicate? Loud voice and the bright color dress. It is mania. Okay. So there will be the inconscient makeup also, and she had a history of depression before. So there is two condition together. There is already manic behavior and will be the history of the depression. What is her diagnosis? Okay, we have the bipolar disorder. We have bipolar disorder 1 and 2 and the cyclothymic disorder, because bipolar disorder 1 will be only in the year there will be having both episode like depression and mania. But bipolar disorder 2, in 1 year itself, there is two attacks, two cycles will come. Cyclothymia disorder, there will be the 3 cycle. If it is more than 4 cycle in 1 year, it is called the rapid cycle. Okay, that will be the thing. So here the answer bipolar disorder 1. Got the point? So next, it will be the last. Okay, so answer we have seen in the psychiatric. Extrapyramidal adverse effect and symptom are most often associated with the which of the following drug classes? Extrapyramidal adverse effect. Which will be the class of drug will cause the extrapyramidal symptom? Okay, during the psychiatric, we can able to understand. I think you all look for the psychiatric, right? So antipsychotic drugs. Okay, for the schizophrenia and all, we will provide the antipsychotic drug that will cause the extrapyramidal symptom. Okay, don't forget. Okay, we'll finish this video, and next one we will be just discussing the endocrine and the urinary system eye disorder question answer. Okay, I will send you the link. Join with me.